We're kickstarting a new year on this thing called the Just Start the Conversation podcast, and not only here, but everywhere. And I'm always fascinated by the people that always get upset with New Year's resolutions. People want to do better for themselves, and there's people out there that are just like, what do I need it for? I think anytime we can hit a reset, get a restart, take a look at things a little differently, maybe some of the things that are stressing us out to start a new year and trying to minimize those things and get rid of those things, I think is a great thing. And today, especially when we're talking about the impact of stress on heart health, that might be a very good New Year's resolution. It's the Just Start the Conversation podcast. It's brought to you by St. Luke's Penn Foundation. You can get more information at stlukespennfoundation.org. As always, I am joined by my friend Amie, Alanson, Dundon. A happy new year to you, my friend. Good to catch up as always.
Absolutely. I always love the start of the year. I love rolling into spring and, just being more intentional about self-care.
Spring is the word that I want to run with here because it's just too dang cold in the Lehigh Valley right now. To your side there is Bill Merkert. He is our guest today. Bill is the director of Cardiopulmonary Rehabilitation there at St. Luke's. Bill, I want to thank you for joining us today, and Happy New Year to you, my friend.
Yes, absolutely, and Happy New Year to you.
I appreciate it. So we're going to dive right in here as we talk about the impact of stress on heart health. And I guess the easiest way to kind of start is, how does stress contribute to conditions like hypertension or arrhythmia or heart disease?
Well, I'll certainly start. I'm not the expert on cardiac health here. It's Bill. But what we do know in the world of psychiatry is that it's called a bidirectional link. And what does that mean? That means mental illness increases heart disease risk, and heart disease increases mental illness risk, right? So unfortunately, they go hand in hand. And there's a very large correlation between anxiety, depression, stress, and heart health. And we can certainly get into the why of that. But chronic stress physically can damage our heart. Right, Bill?
That is correct. Chronic stress kind of keeps us in that fight or flight response where it adjusts, produces more hormones out into the bloodstream, causes constriction to the blood vessels, therefore, raising the blood pressure. Blood pressure is a major risk factor in, high blood pressure is a major impact on cardiovascular disease and cardiovascular health. It also can increase arrhythmias of the heart itself. So controlling those factors of the stress will reduce that risk of the heart arrhythmias and blood pressure.
Yeah, the sympathetic nervous system is what Bill's referring to, and when we get it dysregulated, right, it throws all sorts of chemicals into our body that do not so nice things, right? So it is related for sure.
I'm curious because as we talk about these psychological elements, there are also the physical elements that come with having an issue with your heart. Amie, I'm going to start with you on this one. The difference between recognizing that maybe you're just going a little too hard in a particular day, I'm just having a long day here, versus maybe something that's persistent, that's sticking around, and ultimately you think, okay, maybe this stress is actually giving me more of a long-term issue, harmful physical effect for a long-term stretch. Just maybe the differences between I know when it comes to your heart, you don't want to mess around with anything, right? So if you are experiencing something in a day, do something about it. But perhaps if there's something that you're starting to notice is consistent, maybe the point of either, being like, okay, maybe I just got up a little too early, stayed up a little too late, or getting to a point where it's like, okay, we've got to get this addressed sooner rather than later.
Yeah. I mean, honestly, I'd rather turf that one to Bill. I mean, I know what I would say, but, when do you know it's a problem with your heart?
And I think the first thing to recognize is that not all stress is bad stress, but that chronic stress that continues to, for lack of a better term, eat at us and stay with us for a long period of time. Obviously, monitoring the blood pressure, monitoring heart rate, And one of the other things that the doctors may take a closer look at is your heart rate variability, kind of identifying how you can respond to these stressful situations. So you have some occasional stressful situations. It's actually might be a little bit healthy to you, especially stress under, say, exercise. But when you're perceiving high stress levels, day after day, it's going to put wear and tear on the body, especially the blood vessels, and can also result in thickening of the heart muscle, and ultimately, too long, it can weaken the heart muscle.
Amie, I want to talk a little bit about the mental health conditions that come with some of these physical conditions that might surround you if you're having an issue with stress and with your heart. Just if you could go into that a little bit, that could exacerbate these effects that you're already having going on in your body.
Yeah, so depression, anxiety, and even post-traumatic stress disorder are all psychiatric conditions that we see an increase in with folks with coronary artery disease or hypertension, chronic severe hypertension in general, right? Anger, fear, depression, all contribute to the development of coronary artery disease. So stress and anxiety flood the body with cortisol and adrenaline, which is kind of what Bill was saying earlier. That's where we see an increase in blood pressure, an increase in inflammation, an increase in plaque of the arteries. And chronic depression, let's think about it. Folks that are chronically depressed sometimes sleep too much, sometimes have trouble getting out of bed. They're more sedentary. They're not as active. They're maybe going to not pick the healthiest foods, right? So being depressed or having even adjustment disorder that's prolonged, that's contributing to a mental health depression, contributes to a lifestyle that often leads to increased cardiac risk, right? So anxiety, we've talked about stress and how that HPA axis, that cortisol flood can do a lot of damage. But so that's where anxiety and heart issues are related. Depression oftentimes is related just more by the fact that we're not taking care of ourselves. We're too depressed to do anything about it. And post-traumatic stress disorder, let's think about folks, we've talked about trauma a lot on this podcast, and when you are confronted with a traumatic event, and a lot of people, like we talked about first responders, hundreds of traumatic events, that surge in adrenaline over and over and over and over again, if you're not taking care of yourself with exercise and proper diet and regular visits to your primary care physician, it's very often going to sneak up on you. So that was a long answer to depression, anxiety, post-traumatic stress disorder. Depression is actually probably one of the highest links that psychiatry and the cardiovascular team work together with patients that kind of have that depression and that cardiac issue.
Bill, I want to pivot to you off of those thoughts that Amie just had there. Is that kind of where I loved, Amie, how you just said you kind of have this collaborative effort with the two of us or with the two of your departments. Is that kind of where you always start for a person in your position that maybe says, we can get into demographics and ages and all those things in a little bit, but is that kind of always where conversations about heart issues start with you? Is it, well, how is your diet? How is your health? Is that kind of like the baseline, let's start here and then see where things are from there?
Yeah, absolutely. We look at what are the risk factors. There are controllable risk factors. For example, hypertension, body weight, controlling your blood sugars, making healthy dietary choices. Unfortunately, there are some uncontrollable risk factors where we can't choose our parents, so that genetic predisposition. We can't choose our age and we can't choose our gender. But we focus on the overall risk factor modification. And the group that I primarily work with and my team works with are those patients who have already had a heart-related event. And, let's face it, nobody expects to have a heart-related problem or a traumatic event like that. So when the patients come into us in cardiac rehab, they may be depressed, they may be anxious, they're definitely fearful. Like, what next? What do I do?
Sure.
And, so that's one of the areas that we try to focus in on and support that. And not really, trying to promote cardiac rehab per se, but, a lot of patients will forgo it thinking it's just exercise. And it's comprehensive lifestyle modification, but when it comes to that emotional component, there's peer support when you come into cardiac rehab. It's very common for my team to say, hey, we don't share, health information, but we might say, hey, Bob, you might want to talk to Joe over here. You guys went through something similar, and get them talking. And sometimes, we'll find that patients will need additional help, and that's where, we reflect back to Amie's team and say, okay, this isn't just something subtle. This patient may need a little bit more help, and we'll recommend, our behavioral health program.
I love that you brought that up, Bill, because a running theme on this show is we're 51 episodes in is peer support, people in similar positions, leaning on people who have been there before. So I'm really happy you brought that up. I want to come back a little bit too, because you mentioned family history. And then I kind of brought up demographics and age groups. And so, Bill, for somebody in your perspective, do you see stress related heart issues more often in certain demographics or age groups? Anything in particular that you're looking at right off the bat there?
Yeah, through my observation over the years, our younger demographic are those who often have a lot of either family stressors or high stress jobs. And, not only is it the stress itself, but as Amie mentioned earlier, that it promotes kind of that not so healthy lifestyle, making poor dietary choices, maybe, going to smoking for your stress management, lack of exercise, spending too much time at work. So generally, when I see that in a younger population, we see those characteristics as well. Now, as we age, we are at a higher risk for cardiovascular disease. So we have other risk factors associated as we're aging, and now we throw stress on top of that, and an unhealthy lifestyle on top of that, and we're going to see a higher incidence of cardiovascular disease. Men tend to have a greater risk for cardiovascular disease than women. Once we reach the late 70s, early 80s, we're pretty much equal. But one of the things that I'd prefer I didn't have as a risk factor is men tend to develop heart disease a little bit sooner in identical situations than a woman.
Why is that? Do we know?
I don't know if I have the exact answer for that, but genetic predisposition.
No. Just the gender.
And
just the male gender.
The male gender.
Huh. Okay.
So, and interestingly enough, I keep track of our population coming through cardiac rehab, and we are very consistently 66% men, 33% women. It's 2/3 men, and that's been going on year over year. I've even reached out to our docs saying, "Hey, is this our same demographic in the hospital?" And I think we do lose some of the women coming to cardiac rehab as a result of, that preconceived notion that, it's just exercise and I don't exercise.
Okay.
Because there is a little bit, the balance isn't quite the same in the hospital, but it's pretty close.
So maybe men are more likely to follow through on the actual cardiac rehab and go to do their exercising, and women are not as good students.
Yeah, unfortunately, and I encourage the women and everybody, who's eligible for cardiac rehab. So I sound like I'm promoting the program. I guess I am, because I know it works. I've been doing it.
Yeah, I mean, cardiac rehab it's also cardiac rehab is proven if you're following a good cardiac rehab program that your cardiologist wants you to do, your mental health gets better. It all correlates. So.
Yeah. And, go ahead.
No, please, Bill, continue. You're on a roll right now, buddy. Keep rolling.
She hit a point. And one of the most exciting things I ever heard from one of my patients, and this must be 20 years ago, and on his way out the door, he says to me, he goes, I got to tell you, he said, my doctor saved my life, but you gave my life back to me. Oh. And I'll tell you, this is over 20 years. Even just now saying it, I got the chills because that's what we do. That's our goal.
Sure. That's amazing. Amie, I want to come to you because Bill had alluded to the stress that comes after you've already had a cardiac event and now you're probably having more stress as a result of the cardiac event. Coping strategies, therapies, things that are there for people to kind of help when these events happen, to kind of help reduce that stress. I mean, I think we've talked about some of the very obvious health things. What are you doing with your diet? Are you exercising? Those sorts of things. But coping strategies, therapies that are there to embrace this idea of reducing stress and the health risks that come with it.
Yeah, so it's probably not going to shock anyone to hear that one of the best therapies for folks that have a cardiac-related mental health issue are ones that are going to increase your ability to regulate your emotions and be less stressed and find a way to kind of dial it down a little bit. So that would be certainly our mindfulness-based, our dialectical behavioral therapy, mindfulness-based meditation, guided imagery, yoga, kind of the less intensive. Absolutely, you have to do your cardiac rehab where you're on the treadmill, and I think it goes hand in hand. But at the same time, you have to learn how to self-regulate. Mm-hmm. To Bill's point, if you're working 50, 60, 70 hours a week, and you don't know how to turn that off, and then you're going and doing cardiac rehab, and you don't know how to take your sympathetic nervous system and dial it back a little bit, you're going to wind up in the same space. So psychotherapy that's going to involve CBT, cognitive behavioral therapy, right? Reframing your thought process. What can I tell myself about my anxiety related to having to work 40, 50, 60, 70 hours a week, that maybe I could look at that and reframe that differently. I could think about it differently so that it wasn't contributing to my high stress, my high anxiety. So cognitive behavioral therapy, mindfulness-based strategies to help with emotion regulation. And also oftentimes what's really helpful, and Bill alluded to this a little bit, is group therapy. When you're talking to other people that have also had a medical event, oftentimes being able to kind of bounce your anxiety and stress and concerns off of other people who have been through it is really, really healing. So whether you're doing that next to somebody on a treadmill at cardiac rehab, I would consider that group therapy, right? Or you're coming to a formal behavioral health group, that's great too. Sometimes psychiatrists will want to talk to you about if you have prolonged stress and maybe a generalized anxiety disorder or a post-traumatic stress disorder, maybe medications would help along with exercise and mindfulness. So it really is going to depend on the individual, but cognitive behavioral therapy, mindfulness stuff, and really helping people to reset goals, mental health goals, emotional wellness goals. What do I want this next 6 months to look like? I've just been through a major event. I've got to make some lifestyle changes. And part of that is emotional regulation changes. Am I hanging out with people that contribute to my mental wellness, or am I hanging out people that are drivers of my stress? I need to take a look at that. Also,
go ahead and say it. Are you a Philadelphia Eagles fan? Go ahead and say it.
Right. Goodness. Those of us that are Philadelphia Eagles fans need to have a coronary check probably very soon. That's a great point.
Bill, I want to piggyback on that, though. This idea of patient education, peer support, these groups. Just listen, Amie and I alluded to it earlier in the podcast. It's one of the things that Amie and I will continue to bang the drum on over and over again on this show, is leaning on people who have been in situations that you've been in. It can feel like a really lonely space, especially if you're coming off of a cardiac incident where maybe you're feeling like at everything you're doing, every turn you're making, every decision you're making, every food you're picking could just have this big overwhelming effect on you. And leaning into people who have been there before is probably a huge part of the recovery process. So I just want to talk to you a little bit about patient education, the role that plays, and the peer support groups that are available for folks.
Yeah, absolutely. I mean, I can't overemphasize the necessity for risk factor modification. Kind of, again, as you're saying, piggyback off of what Amie was saying, we can treat with medication. We can treat some of the impact, like high blood pressure, with medication. But if we don't get to the root cause, we're going to see the same results over and over. So we definitely want to make sure we're getting to the root cause. But when it comes to, especially with our department with cardiopulmonary rehab and focusing on the cardiac rehab side, we emphasize education in terms of techniques for stress reduction. We are an informal support group, but that informal support group is, I just see tremendous benefits from that, where, our patients get together, they talk about what's going on with and how they're progressing. And generally, we're seeing patients who are coming in at different levels, where one may be in their first week and the other patient's in his 12th week. So if we connect that first week person with a 12th week person, they're going to have a higher level of support. But again, smoking cessation, when you're talking about patient education, it's very common for someone who is anxious or depressed to turn to unhealthy lifestyles, and smoking being one of them. And I often tell our patients, not all things about smoking are bad. And I don't want that taken out of context. But the point being is there's a ritual behind smoking. The ritual actually isn't that bad. You're sitting at work, you're all stressed out. I need a smoke break. You get up, you go outside. So now you left that stressful situation. You provided an opportunity to regroup. Smoking itself provides deep breathing exercises. So that's part of it. Now, let's just take the smoke break without the cigarette, because we don't have enough time to talk about all the negatives of smoking today.
Right.
But the ritual actually isn't that bad. Just leave the cigarette out of the picture.
Amie, go ahead, because I see you kind of nodding along.
I never really thought about it that way.
Yeah.
I think that's genius, really, honestly, as a way to get people to do their emotion regulation and keep their quote unquote smoke break habit, but not use nicotine.
Sure. Bill, you had mentioned earlier, you mentioned a patient who had that nice thing to say about 20 years ago to you. And so that means that you've been doing this for a long time. One of the things that I love talking with Amie about is in all these different topics, there's an evolution that's transpired since people started in whatever their specific work life has taken them. Over 20 years, you've probably seen a lot of growth in what is cardiac care and the stress on heart health and all of those things, and how people are looking at it in different ways. Are there any emerging medical interventions or research findings that kind of have you excited about giving us more opportunity to help people who are dealing with an issue after an issue with their heart?
So what's interesting is we have learned how to keep people alive longer. So as far as technologies, We have less invasive technologies to help with the heart. Over my time, I actually started with St. Luke's 37 years ago. I just had my 37th anniversary.
Congratulations!
And I've been here. I was still in diapers. At least we would like to think so. But it still comes down to the core basics of healthy lifestyle modification. So, back in 1988, when I started, we were teaching, lifestyle modification. We're still teaching lifestyle modification today. The interventions have greatly increased. Back in 1988, we weren't routinely doing cardiac stenting, and almost everybody went for bypass surgery after a heart-related problem, and even that was relatively in its infancy. There's more blood tests out there. They can, they can measure some of the stress hormones. They can, take a look at, kind of the heart anatomy and the blood vessel anatomy, less invasive. But it still comes down to controlling those risk factors.
I want to talk real quickly too, Bill, about the benefits of cardiac rehab for patients who have already had a heart event, because, we alluded to the fact that you're already stressed out. It's already happened. You're probably already. So coming in and feeling like you've got to start something from square one, I think for a lot of people can feel overwhelming. We touched on it a little bit, but I know this is your wheelhouse here. So the benefits of cardiac rehab for somebody who has just had a heart event, and why it is the number one thing that they should be coming in to take care of.
Yeah, thanks. Absolutely. I think everybody who's had a heart-related issue should come to cardiac rehab. If we just look at the statistics of cardiac rehab, patients who come to cardiac rehab reduce their risk of hospital readmissions. They greatly reduce their risk of a future heart problem. And overall, it's a combination of telemetry monitored exercise. The patients are on a heart monitor, and that really in itself gives a sense of well-being to our patients. Again, you come out of heart surgery, you come out of a heart attack, you're nervous, you're afraid, you're anxious, and now you're on a heart monitor. You're starting to do some activities. You're on that heart monitor. We're able to watch your heart rate, your heart rhythm. We monitor the blood pressure. We have an educated staff working with you to make sure that things are done as safely as possible. And then you can take that information, the way you're feeling there in cardiac rehab, and mirror that with your home activities, and kind of give yourself your own feedback of saying, hey, I'm working this hard in cardiac rehab, and they're telling me everything looks good.
Yeah.
And now I can do these things. And then, of course, focusing on, reducing those risk factors. So, there's a physical component with the exercise. There's a big nutritional component where we talk about healthy eating and, working on lowering the cholesterol level and the blood sugar control. And, then there's that emotional component. And again, we have that informal support group. We have the peer support. We have the staff support. And, we also refer out when necessary.
Amie, I want to come back to that emotional component that Bill was just alluding to here. This is the Just Start the Conversation podcast, whatever that conversation is. And obviously today it's about stress on heart health and making sure that we're taking care of those things. What advice would you give to someone who feels overwhelmed or who doesn't know where to start managing their stress? We always try to find, it's the Just Start the Conversation podcast. Where do we start for somebody who feels like, whether there has been a heart related issue already or an incident or anything like that, if you feel like something just doesn't feel right, the best places to start?
So if you have a cardiologist, make an appointment with your cardiologist, because to Bill's point, you want to ease your mind, because there's fear of having another heart attack or having another heart event, or I don't want to push it and walk an extra mile because what if? Well, if you've already done it under a monitor, under monitoring, you're fine, right? So talk, if you have a cardiologist and you're concerned, talk to them. Talk to your primary care doc. We want to make sure medically we are ruling out any issues. Now, then, that being said, if you're finding yourself anxious, depressed, more stressed out than normal, and you've talked to your medical providers, then, psychotherapy is a great place to start, to sit down and do some cognitive behavioral therapy to help reframe those thoughts that are contributing to your depression and your anxiety. If, again, we go back to it all the time. If you're part of a spiritual group and you have a church community, that's often a great place to go to get some spiritual support with your spiritual advisors and your peers in the religious community that you're in. But there are also the American Heart Association has some really great, if you just Google American Heart Association, there's some online supports through the American Heart Association. There's some really good educational information. Educate yourself through reputable resources, ones that we know are valid. So I would always recommend St. Luke's. And Bill's team, I would always recommend our psychiatric folks and our therapists, and I would always recommend the American Heart Association in whatever context you want to get involved with them. But the supports are there.
You started that thought with the phrase, ease your mind. That's what we're trying to do with this podcast. And I think that's a good thought there to hang up the headphones on today. So for Bill Merkert, he is the director of Cardiopulmonary Rehabilitation at St. Luke's. Bill, thank you so much. A lot of great insight today. We certainly appreciated you being with us. Thank you so much.
Absolutely. And thank you.
Absolutely. And Amie, we're just easing minds one episode at a time. 51 episodes in. Always a pleasure, my friend. I hope you have an excellent day. Okay.
You as well. Thanks, Crockett.
Thank you. It is the Just Start the Conversation podcast. It's brought to you by St. Luke's Penn Foundation. You can get more information at stlukespennfoundation.org. For Amie, for Bill, I'm Crockett, wrapping this episode up of the Just Start the Conversation podcast.